morning, everyone. On Friday, we recognized that Vermonters lost to COVID-19, and sadly, since then, we've lost at least 2 more. Today, I want to talk to you about one of them, Mary Pat Brown, after an email from her family. Mary Pat was a mother of 6 children, Elizabeth, Christopher, Michael, Denise, Matthew, and Mary, who she raised in Bristol with her husband. And I greatly appreciated hearing from her family, who clearly loved their mom a great deal. In the email, Mary Pat's family shared their grief, saying, "Her loss weighs heavy on us," with the worst part being that we couldn't be with her as she struggled to fight this awful virus. Continuing, our family feels that these deaths need to have names attached to them. Maybe, just maybe, it will spark even one person to do better and try harder to follow guidelines for their loved ones and community. This is what would give our family comfort. So I appreciate the Browns' willingness to share their story and for putting a name, Mary Pat Brown, as a very real consequence of this virus. Because these deaths are not just numbers. They're people who love their families, contributed to their communities, and who are no longer with us. My heart goes out to the Brown family and the families, friends, and caretakers of all those we've lost. This is a tragic reminder of why we're doing what we're doing and of why we're continuing to ask Vermonters to sacrifice, to slow the spread of the virus, protect the vulnerable, and to keep families like Mary Pat's whole. And I know many of you are doing just that. You've stepped up from the beginning, and you made the difficult decisions to avoid getting together with family and friends, staying home instead of traveling, and wearing a mask when around others. So I want to thank you for your help, even when it's hard, or feels unfair, or even when you've disagreed with our approach. I also know there are some who want to do the right thing, but don't quite see the risk in having lunch with a friend, going bowling with people we've known or you've known for years, or having family over for dinner. Maybe you think it's safe because they're good about masking, and none of them seem sick. Or your friend only goes to work and home, so they couldn't possibly have COVID. As Dr. Levine said a few weeks ago, with the amount of virus in our communities right now, even your trusted friends and households are at much greater risk and may not know they have the virus. That's why we placed a restriction on gatherings and required quarantine for all non-essential travel. There's also those who just aren't worried about getting the virus. You may be young and healthy. You can work remotely if you need to, or you just don't think it's a big deal. To those folks, I say your actions could hurt others. You never know when you're going to be the domino that leads to a nursing home outbreak, or the one who pushes an entire school to remote learning. And with enough of these dominoes, we put our healthcare facilities at risk. And the fact is, protecting our family and friends is truly in our hands, and we all have a role to play. So I'm asking you to help by avoiding getting together with people outside your households and not travel this week. If we can get through the rest of this year and widely distribute a vaccine, we'll be able to return to some sense of normalcy very soon. Being smart now means we'll come out of this faster and stronger. Unfortunately, we know there will be some who just won't do it. And we'll get together with multiple households this week. Anticipating this, schools have asked for help in how best to deal with this when kids come back to school. So the Agency of Education will be directing schools to ask students or parents if they were part of multi-family gatherings as part of the daily health check. And if the answer is yes, they'll need to transition to remote learning for 14 days or 7 days and a test, just like they had traveled out of state. Again, we understand how difficult this is, but since we know these types of gatherings have been the cause of so many outbreaks, we've got to do all we can to slow this down. We also strongly advise businesses to consider doing the same by asking employees to quarantine if they aren't adhering to our gathering restrictions. To be clear, this is not meant as a way around the gathering ban. This shouldn't be used as an excuse to get together with other households. The more we adhere to this policy, the faster we'll be in lowering the number of cases, and the sooner we'll be able to ease up on these restrictions. I also want to let you know, and the VPA is aware, based on our current data, that unfortunately we'll be postponing the start of school sports, which were set to start November 30th. Like recreational sports, these are paused until further notice, and we'll review it again each week. Again, this is an example of why it's so important to be vigilant and avoid small gatherings. And it's my hope that adults will realize the need to sacrifice in order to give our kids this important time in their life. And most importantly, help keep them in school as much as possible. We spent a lot of time today and over the last few weeks talking about those who aren't following the guidance. So I want to be sure we recognize the many, many more who are doing the right things. While we've seen record growth in recent weeks, we still lead the nation in the lowest number of cases and deaths. And that's because of all your efforts. So I know asking you to sacrifice yet again is frustrating, but there is light at the end of the tunnel, and we will get there. The fact is, the sacrifice we make today and over the next few weeks will make sure we get to the end faster, stronger, and in a better position than any other state. So thank you for all you've done and will do to get us there. And I'll now turn it over to Commissioner Pichek for our latest modeling data.
Good morning, everyone. I want to start the update again by just putting into perspective some of the recent case growth that we've seen across the country and in Vermont. This week, the country has passed another grim milestone since our last presentation, passing the 12 million case threshold and continuing to do so at a remarkable speed, adding an additional 1 million cases in just 6 days. To help put this into perspective about just how quickly cases have been growing across the country, all of the reported cases from the pandemic, 26% of them have been in the month of November on a nationwide basis. Considering this another way, nationally we have recorded more cases so far in November than the months of March, April, May, and June combined. Similarly, here in Vermont, we've reported over 40% of our total cases so far in the month of November. Again, put it a different way, we've recorded more cases in November than we did March all the way through July of the pandemic. So you get a sense of just how quickly cases have been going up, both nationally, but also here at home. You can see on the 7-day average that cases continue to trend up. We're just under 170,000 cases per day on average across the United States. And all of this is happening on the doorstep of the holiday season. So this resurgence really could not come at a less inopportune time. Throughout the pandemic, a familiar pattern has developed around major holidays. In the weeks following Memorial Day, across states in the South and West, cases rose, and as did hospitalizations. A similar story played out in the weeks following 4th of July and Labor Day, with travel and gatherings fueling increases broadly across the country. While Vermont was generally spared these previous holiday spikes, recently, with colder weather moving us back inside, our state did experience a dramatic increase in cases in the weeks following Halloween. And that continues to impact us today. And now Thanksgiving is a mere 2 days away, a holiday that unfortunately brings together our two greatest concerns at the moment: travel and indoor gatherings. You can see, based on mobility data from 2019, that a considerable amount of travel did occur during the Thanksgiving weekend last year, where we saw a sharp uptick in visitors over that weekend compared to the relatively quiet weeks that followed foliage season. And that travel was quite extensive. Looking at the next map, we can see that, in fact, during last year's Thanksgiving weekend, Vermont received visitors from every single state in the country. Over 100,000 people are estimated to have visited Vermont during last Thanksgiving weekend, with the number just slightly smaller of Vermonters visiting other places around the region and around the country. This map shows that distribution of visits both into Vermont and out of Vermont, and you can see there's clearly a lot of visit happening in the Northeast, in parts that are continuing to see spikes in the Mid-Atlantic, parts of Florida, parts of Southern California. Again, you can see that the travel was broad and quite extensive. And if we have travel similar to this year, it certainly would be quite alarming. And we can see why it's so critical that Vermonters follow the public health guidelines and the travel policy and quarantine or stay home. We looked also at a Thanksgiving analysis, trying to determine what might happen if Vermonters don't follow the public health guidelines. What might happen if Vermonters decide to continue to travel, have visitors come from other parts of the country, continue to have gatherings of 10 or more people in their households. And the results are quite alarming and quite scary, actually. Look at this analysis, we answered three key questions. How many people will come to Thanksgiving with COVID-19? How many people that come to Thanksgiving would likely spread it to others who are gathering with those families? And then last, how many dinners are likely to occur in Vermont in 2020? Now again, we believe Vermonters, like they always have, will respond to the public health guidelines at a rate much higher than the rest of the country. But unfortunately, national surveys indicate that 38% of individuals are still planning to have holiday gatherings with 10 or more people, including people outside of their household. If we saw numbers similar to that, 38% of Vermonters continuing to have household gatherings of 10 or more people, if we continued to see travel occurring, people not adhering to our guidelines, we would see a significant increase in cases in the weeks following Thanksgiving. In fact, we estimate from both detected and undetected cases, we would see a range of 3,200 to 3,800 new cases resulting simply from Thanksgiving gatherings. And this is on top of normal case growth that would already be occurring. Similarly, those new cases would result in somewhere between 40 and 50 hospitalizations on average. These are certainly numbers that are quite stark and quite disturbing. These numbers would also increase the concerns about community spread. It would allow cases to get into our schools to disrupt learning. It would allow cases to get into our workplaces to disrupt our paychecks. And it would allow cases to get into our long-term care facilities, putting our most vulnerable loved ones at significant risk. Now again, this is not a projection. This is not an estimate. This is really a worst-case scenario. And we really need Vermonters to respond so that we don't experience anything like the numbers we just mentioned, or even a small percentage of the numbers that we just mentioned, because it would have a significant impact on us during the weeks ahead. We see a case distribution on the next slide that would show what that additional case growth would look like. We would see cases spike over the next 2 to 3 weeks leading into the holiday shopping season, leading into next major religious holidays in December. So again, all the more reason for us to really follow the guidance here at Thanksgiving when we have an opportunity to continue to keep our work, or keep following the guidance and keep our cases at a manageable level. Looking at the regional update, I do want to just provide a couple of other items that are less pessimistic and things that I think Vermonters need to be aware of and focused on. You can see that the regional travel map continues to be red, and the heat map that we update every week continues to show areas of our region that have considerable growth in cases. Unfortunately, one of those areas of growth is right here in Vermont. When you look at the top 10 counties by active case counts, you'll see that Washington County is in that top 10. It's higher than places in New York City metro area, higher than places in outside of Boston and inside of Boston, higher than any county in New Hampshire or Maine. So certainly, this is something for those that live in and travel to Washington County to be very mindful of just how significant the case growth is in that county when compared to the rest of the region. Similarly, when we look at our Vermont map, we can see that really for the first time we see sustained growth in Washington County and in Orange County. Oftentimes when we do these maps, you see cases move around the state and not necessarily in a sustained manner. But here, like the regional map indicated, there is sustained growth week over week in both Washington and Orange counties. Now, there are some reasons to be optimistic about the numbers that we're seeing. For one, if we skip ahead to the regional update, you'll see that although cases did go up across the region, they went up only about 12%. Last week, for example, cases went up nearly 50%. And if we go to the next slide, you'll see what that case increase looked like week over the past 4 or 5 weeks or so. The trend continued to go up in terms of the percent of cases growing, and now for the first time in weeks, we've seen that growth rate slow down. So again, some reason for optimism. When you go ahead to the next slide, you'll see again, we're keeping close tabs on that 10 to 14 day period after the new mitigation measures were put into place. Now it's very early. We're just approaching that period of time where we would expect to see some results from those mitigation measures, but it is encouraging. We see case counts have stabilized, and today, when we're sort of entering that first 10-day period, they're actually lower than they have been in quite some time. Similarly, looking at our Vermont forecast, you can see that even though it's trending up still, it's not growing as quickly as it was last week. Last week, the expectation was that we would see case growth over the next 4 weeks of about 50%, now down to 41%. So again, certainly another positive trend. But again, with these positive trends happening right before Thanksgiving, all the more important to follow the public health guidance and avoid any sort of Thanksgiving surge here in Vermont. Looking at the hospital forecasts very briefly, we talked about this last week. You can see the historic numbers and then the forecast numbers based on our case growth and anticipated case growth. And we've also added to this 2 different specific analyses looking at general hospital beds and then ICU beds. So the first one looks at general hospital beds. You can see even with the increase in COVID cases expected, and hopefully it's less than what's expected, we still have plenty of capacity between that green line and the rise in COVID cases. Similarly, looking at the ICU forecast, even though we are expected to see ICUs increase in the next few weeks, still well below that green line threshold in terms of capacity as it stands today. So again, another reason for optimism. We have sufficient hospital capacity at the moment, but all the more reason for us to make sure we maintain some of this, what appears to be positive momentum going into the holiday season. Just very briefly on Restart, we've talked about a number of these items so far in the presentation, but we continue to watch our growth rate closely. We continue to watch our positivity rate closely as well, waiting to see signs that both the positivity rate and the growth rates are starting to trend back down, again, during that 10 to 14 day period following those intervention measures. So that's something we'll certainly be looking at this week and reporting on next week. And just to go through some quick updates about K through 12, higher ed, and then long-term care facilities as well. You'll see that across the region, cases in K through 12 have continued to go up, although again, Vermont markedly less than the rest of northern New England, adding 36 cases this week with a total of 110. Compare that to the 71 cases added in New Hampshire, bringing its total to 574, and the 20 cases added in Maine, bringing their total to 313. Similarly, with higher ed, we see that Vermont added 54 cases, like Maine with 60 and like New Hampshire with 122. The trends in college campuses have reflected the trends in communities, not just in Vermont, but across the country. As community numbers have gone up, so too have the numbers in college campuses, both here at home and across the region. So again, another important reason, as many students are traveling home for Thanksgiving, for them to quarantine and follow the public health guidelines so not to spread cases when they return home. And then last, this is a new update that we're providing this week, but this is an update on cases in long-term care facilities. You can see that there are 6 active outbreaks that we are reporting on, and you can see the case number there, totaling 100 cases in those facilities. So at this time, I'll turn it over to Dr. Levine.
Thank you. Just to begin with a few extra numbers, we reported 85 cases of COVID-19 yesterday and are reporting another 49 today. There are 22 Vermonters hospitalized, 5 in the ICU, and unfortunately we are now at 64 deaths. In terms of total numbers of school situations, which means cases of concern, not outbreaks, there are 43 we are currently following. Before I get into my general comments, I wanted to spend a few moments about this kind of data and what's going on with hospitals. You may have noticed that while we've had an increase in hospitalizations, like the rest of the country, we've had very few in the ICU and very rare patients actually on a ventilator. I can help make some sense of this for you. Really, this is testimony to the healthcare profession's increased experience in caring for ICU patients and general patients with COVID-19, as well as advances in our medical knowledge. With one exception, this also relates to non-medication interventions. These kind of interventions include prone positioning, which helps ventilate and expand the lungs more effectively in recognition of the fact that so much of our lung capacity is actually towards our backs. In addition, the use of high-flow, humidified, pressurized oxygen through the nose or by devices like CPAP masks have been critical to success. Turns out, humidity is an enemy to the virus. And finally, the use of the steroid medication dexamethasone for patients with an oxygen saturation below 94% on room air is clearly preventing patients from requiring ventilators and probably saving lives. There are new developments around medications for patients both in the hospital and prior to possible hospitalization. The major antiviral drug that has been in use for hospitalized patients has been remdesivir. 4 days ago, the World Health Organization updated its guideline, and based upon the absence of better evidence for efficacy of this medication, suggested against using it regardless of disease severity. They felt there was no indication or evidence for impact on mortality or need for mechanical ventilation or time to improvement. Practitioners in Vermont are now using this information and reevaluating their use of that drug. And the monoclonal antibody bamlanivimab, which just received emergency use authorization from the FDA and is being shipped to states like Vermont by the federal government, unfortunately received unfavorable reviews from both the National Institutes of Health and the Infectious Disease Society of America. The NIH felt that there was insufficient data to recommend for or against the use of this drug, which was thought indicated for preventing outpatients with mild to moderate COVID-19 from needing hospitalization, and that it should only be used in a research trial. The Infectious Disease Society of America also suggested against routine use of this drug because of the low certainty of evidence at this time, though left as an option, use in a shared decision-making fashion, weighing the uncertain benefits and the risk for adverse events. So we've just heard from Commissioner Pichak that the surge in cases we're seeing around the country and here in Vermont is trending favorably, but it's certainly not going to end soon. But that does not mean that these rising number of cases are something that we just have to get used to. We don't throw up our hands and let the virus run rampant, overwhelming hospitals, threatening our lives, and those of Vermonters who are most vulnerable. We are better than that. And our track record from March until now is proof of that, from a public health and a healthcare system standpoint, and in the way we've been able to live our lives in the midst of this pandemic. But as Dr. Fauci told us, this is not the time to let our guard down and be complacent. I know that what we are telling Vermonters to do right now, to give up spending time with friends and with family members, is difficult. And I also know how done we are with this pandemic. But the fact is, Thanksgiving could make things a lot worse for us here in Vermont. The virus doesn't operate any differently just because we want to keep up traditions. As soon as we travel, get together with friends, let down our guard, we actually do risk reopening the floodgates even wider at a time when we really need to keep them closed. So if you want to keep working, for your kids to stay in school, to prevent more people from potentially dying from COVID-19, please follow the governor's orders. Don't get together with anyone outside your household and limit any travel that's not essential. And how do we know the strategy will work? Because our data tells this story well, and our prior success tells us we have the tools to suppress this virus across all communities in Vermont. And if you do gather with another household, you should quarantine. This helps prevent the spread of COVID-19 before a person knows they're sick, or if they are infected with the virus and don't have any symptoms, which might happen as much as 40% of the time and leads to the insidious spread of infection, sometimes to those who can least afford to have it. Quarantine means staying home and away from other people for 14 days. Do not go to school, do not go to work, do not go out to do errands or recreation, other than perhaps a walk alone in the woods. We advise you to get tested as soon as possible after the gathering, and then again on day 7 or later. If you continue to have no symptoms, you may end quarantine early with a negative test result. This will help give Vermonters greater confidence that they can go to work and send children to school and childcare safely. College students are also returning home to Vermont now, so I remind parents that they too need to quarantine and should also get tested. I've heard people say that Thanksgiving is canceled, but I hope Vermonters don't see it that way. Yes, admittedly, it will look different, like everything else has this year. But I believe we can be creative once again to find the joy in a smaller celebration at home within our own households. We can still make Thanksgiving special. Learn to cook a new dish or teach someone else how to do it. One of our friends has decided not to travel out of state and instead will be coaching her friends by Zoom in the art of gravy preparation and baking a pumpkin pie with her renowned crust recipe. Some may enjoy not having to cook. Think of everyone you would normally look forward to seeing and give them a call, or find a way to help someone else in need. And on that note, I'd like to close this portion of my comments on the topic of gratitude. 2020 has been a challenging year for everyone, and some may feel less grateful due to job loss or food insecurity. Keep them in mind as you consider this holiday season, and consider sharing with others. such as via donations to local food shelves, which seem to be very active still during the pandemic. But for everyone, be thankful for what you can. Gratitude can help you feel more positive emotions, relish good experiences, improve your health, deal with adversity, and build strong relationships. Research shows a correlation between expressing gratitude and having a more optimistic approach. In the words of the sage philosopher Willie Nelson, who does a fantastic rendition of Moonlight in Vermont, by the way, when I started counting my blessings, my whole life turned around. And maybe think about next Thanksgiving, when we will look back on this year knowing we have done the right thing. I'll turn it back to the governor now.
We'll now open it up to questions.
All right, it is 11:37. We have 26 in the queue. Please remember, try to keep it to 1 or 2 questions. And if you do have questions about data needs, you can bring those to me separately after the press conference. We'll start in the room with Calvin.
Thanks, Governor. So assuming the 3,800 cases worst scenario from Thanksgiving happens, what other tools do you have in your toolbox, whether it be restrictions or anything like that, to try to curb some of these cases?
Yeah, you know, I'm very hopeful that the measures we're putting into place will have a positive effect. And I think we're possibly seeing a little bit of that. As you might recall, it was 2 to 3 weeks ago when we had Halloween. So the number of cases has dropped a little bit. We'll see if this is a trend or not. So again, I'm hopeful that we don't see that rise. But we have a lot of other tools at our disposal. We utilize them in the beginning of the pandemic and the crisis. We don't want to go there. We don't want to close down any more of the economy than we have. But certainly there are other approaches that we could take if necessary. But again, we've learned a lot since day one. And we'll do whatever we can to effectively put a stop to this. But some of this, as we've seen, you know, we saw this over the last 3 to 4 weeks. It really is about the data and the science is showing us. It's about social gatherings. It's not about work. It's not about school. It's not about retail operations. It's about getting together within your neighborhoods and with your friends at recreation events and so forth. That's what's driving the uptick right now. And so if we can prevent that from happening, we won't have to take any further measures.
And then regarding students being asked when they come back from Thanksgiving if they attended a gathering, and also potentially employers doing the same, I guess how confident are you that people will tell the truth?
Yeah, again, you know, it's I'm just hopeful that they will for the good of everyone, because the sooner we can put a stop to this, the faster we can get out of it. And so I would ask everyone to be truthful. And if in anticipation of that question, maybe you ought to cancel some of the plans you might have right now. I know it's difficult. You know, none of us wants to go through what we're going through right now. But if we make these sacrifices now, we can get through the hump. We can get over the hump into the next year when the vaccine will be there. I mean, we've seen some promising news with the vaccines, and now there's a third that is encouraging. So I believe after the first of the year, then we'll start seeing a real ramp up and really countering it and going on offense. Instead of playing defense, we'll be going on offense after the first of the year.
Ross?
Question for Dr. Levine. The governor just brought it up, but the encouraging news about a new vaccine this week. Now there are 3 from 3 of the largest drug manufacturers in the world. Curious what your takeaways are from those initial findings, and maybe which of the 3 vaccines you're most encouraged by and think might be best for Vermonters.
Yeah, this is very encouraging news. We have the Pfizer, the Moderna, and now the AstraZeneca. Several different variations on the theme of vaccine because they each have their own unique properties. It's really challenging to answer your question about preferentially which one for a Vermonter versus another from the standpoint of the data, because frankly the data hasn't been released for us all to scrutinize. and that's important because we really do want to understand their measures of efficacy and if any adverse events were more frequent in one versus another. My understanding to this point is adverse events are very low percentage in them, which is very encouraging. One thing that raises one above another, if they are all on equal footing, would be how many shots one has to get, because we expect, due to human nature, some people will forget the second shot, or for some reason won't want to do that, so a vaccine that had only one would be nice. The other thing is the storage temperature, and as we know, the first one, the Pfizer, requires the ultra-cold, very specialized freezers, whereas the last one, the AstraZeneca, does not. So those could be considerations, but we're kind of ready for both because we already have the freezer capacity, and as Commissioner Sherling said a couple press conferences ago, we received even more to make sure that that won't be an issue. So I'm encouraged.
Thank you.
Steve, good? Okay, we're going to move to the phones, starting with Ethan from the Burlington Free Press.
Morning.
Good morning. Go ahead.
So there was a recent New York Times article, I believe it came out yesterday, that seems to be calling into question state orders around limiting small gatherings. It cited some national epidemiologists who were claiming that there was little evidence to substantiate that private or social gatherings are the primary source for types of outbreaks versus, but I know we just got to see today's modeling, so I was curious if yourself, Governor Scott, or Dr. Levine, or Commissioner Pichek had anything to say about the article, if you've gotten a chance to read it, just what were your responses?
Yeah, again, I will refer to Dr. Levine, but from my perspective, I did read the article. I think in some respects it was unfair because they really weren't on the ground here in Vermont. What works in New York City or what works in California doesn't necessarily work here, and vice versa. We relied heavily on the data. I can tell you from the contact tracing we did, it all points to social gathering. Almost every single one of those cases was derived from a social gathering. The outbreaks we're seeing in Washington County in particular will point to that. So in some of the, the analogies they were using, I remember one in particular, they said that it was counterintuitive that you could have 9 friends and go to a restaurant for dinner or lunch, but you couldn't have them over to your house. Well, that's not the case here in Vermont. We only allow you to go to a restaurant that, first of all, we are at 50% capacity in our restaurants. Secondly, you can only gather, you can only go to a restaurant within your immediate household. You can't have 9 of your friends and go to a restaurant. So I thought it was a bit unfair in many respects and didn't really dig into what we do here in Vermont. And I just want to go back to what we've done thus far. Everything that we've done, we haven't done everything right, but for the most part, we've done better than most other states, and we've been highlighted because of that. And I would say what we're doing today, I believe, will be beneficial for us, especially over the next a couple of months. And again, we rely on the data and the science and get together as a group with all the experts and make decisions based on what we're seeing on the ground. And I don't think the reporter really got in on the ground here in Vermont to see what we're going through and why we're doing what we're doing, because I think it was based specifically on the science and the data. Dr. Levine?
I can only echo what the governor said. There may be states where actually the data does not support mass gatherings being a prime culprit in their surge in cases. But you only have to look to events like the motorcycle rally at Sturgis to know that a really large gathering can cause a lot of trouble. And then you go to Maine and look at a church gathering and in an unmasked state and know that that can cause a lot of trouble. Our Vermont data clearly points us to the strategic priorities and moves that we've made. Specifically looking at travel and looking at not mass gatherings, but even small gatherings. And as the governor said, the Washington County data supports that the most. The other part of the article, unfortunately, was it didn't actually acknowledge the good work Vermonters have done and the vast experience we've had since March to account for our successes, and kind of picked on the issue of taking a walk with a friend, which, as you heard at the last press conference, is certainly acceptable in Vermont at this point in time, but we don't want to have people gathering together, not socially distanced, not wearing masks, and feeling that the comfort of the outdoors makes that all possible in getting together in a large group from multiple households for physical activity outside in that way. So I can accept the fact they couldn't nuance everything in the article when they're trying to cover numerous states. But I think we've answered your concerns satisfactorily.
Good, thank you. My last question is geared towards Secretary French. I was curious, is the event concerned that families might hide information about their family gatherings to avoid having to remote learn, based off of just what Governor Scott said about the state allowing schools to ask families if they gather with other households?
Yeah, I think it's a concern. I mean, we issued some guidance late yesterday to help with that and give schools some more specificity on how to address those kinds of issues. Certainly, we're hoping everyone will be forthcoming with their plans. Our common goal here is to contain the virus. So we're hopeful our new guidance will be assisting districts in navigating those issues.
Good, thank you.
Mike Donahue, the Islander.
Thanks, Rebecca. Governor, some people have said they were sort of flabbergasted to hear Governor Cuomo was being awarded an Emmy, apparently for his response to COVID-19 in New York. And initially, I was going to ask you your reaction to that award, but instead, in the spirit of Thanksgiving, it may be time to publicly offer thanks for your personal leadership in Vermont during COVID-19. Yes, some of your state orders may have been unpopular, and you also understand that reporters serve as watchdogs, not lapdogs. But yet you stood here for about, I think, 90 press conferences answering any and all questions. That's probably about 180 hours. As journalists, we talked, and this is really unprecedented transparency and really appreciated. Many of the questions come from readers and listeners across the state with concerns, but you answer them all. And Vermont's the safest state due in part to you. So I'm going to pass some questioning today. Instead, my wife and I wish you and your family a wonderful, peaceful Thanksgiving.
Yeah, well, thank you, Mike, and likewise, we wish you and all the media and all Vermonters very safe and peaceful Thanksgiving holiday, and remember what's really important to each and every one of us. But we'll go back, and it's not me, it's us. It's us as a state, as a team, as Vermonters. We've done a lot of things right, and adhere to the guidance, used our common sense, our ingenuity, and so forth to get us through this. We're going to need to dig deep and get a little bit more of that and use a little bit more of that over the next few months. But I'm confident we'll get through this. And I'm so blessed myself to be surrounded by such a competent team, such a talented team across the board throughout state government, and so impressed. And the sacrifices they've made, and the sacrifices many are going to make on Thanksgiving Day, because, this, as Dr. Levine has said, the virus doesn't know that we're having a holiday. So there are going to be numerous people in the health department, the EPI team, and testers, National Guard, public safety, and many, many others who are going to be working on that day, just like a normal day. So think about them and the sacrifice you might have to make, but think about the sacrifices that they're making for us. So again, thank you very much, Mike, for the accolades, but it really is a team thanks to Team Vermont.
move to Andrew at the Caledonian Record.
Yes, good morning, thank you. I presume this is for Dr. Levine. 8 cases in Essex County is very notable, especially given the decreasing numbers across the rest of the state in today's report. Anything going on with that?
Yes, thanks for that question. The facts around those 8 cases will all be being determined today, so I can't give you the results of that yet because those test results come in overnight and then we connect with them all. So I can tell you that a lot of the increased activity in Essex County is along the border, and there are schools, there are employers that people from New Hampshire come over to Vermont and vice versa. We do know that there's a very high concentration of COVID in that part of New Hampshire as well, so I can only make some speculation that it's all related to the same process, but I don't have any new information on the 8 cases you mentioned. We continue, though, to watch both Orleans and Essex County as places that we didn't traditionally see in our reporting, and we're seeing them with more frequency now. So that's just my caution to people to realize that you can be very, very, very rural and it has no protection against the virus. And that's not just the Vermont phenomenon, that's a nationwide phenomenon.
You've been warning about the possibility of the northern New Hampshire, especially cases and the virus infiltrating through cross-border travel. Are your contact tracers finding examples of people that are ignoring the cross-border travel ban, or are these bubbling up as a result of essential travel that's just a natural course of events in that corner of the state?
Yeah, I think almost all of those initial cases were related to essential travel, if you will. But again, it's a little hard to know if it was essential travel and still advise use of the guidance with regard to masking and with regard to physical distancing, because it really is, a package. Everybody has to abide by all of those pieces of guidance to protect themselves and others.
Thank you. And then one other quick question. Any initial takeaways from the school surveillance testing that was conducted last week? Are all the results back at this point? And do you or AUE, I guess, have a total number of positives that were a result of this test?
Yeah, so I assume by now all the results are back, by today. They weren't actually by yesterday. So we were tallying them up. I was on the air yesterday and mentioned that we thought that the positivity rate would be well below 0.5%, possibly in the 0.25% range. So we're talking, less than a couple dozen cases out of 9,000+ people. But I don't have the precise number of cases and the precise number of tests yet, so I can't give you those numbers with certainty at this point. But there's going to be a very small number, which is reassuring and gratifying, and I think speaks, if nothing else, to the dedication of school staff and teachers who want to keep their schools open and want to keep their kids in as much in-person education as possible.
Okay, thank you for your time.
Craig, the County Courier.
Good morning, Governor. I share Mike's sentiment, but I'm going to pick up the torch here and hopefully ask a couple hard-hitting questions for you. I'd like to start by trying to get an answer that couldn't really be answered much on Friday. What does the state really have for enforcement if somebody refuses to quarantine and has tested positive? That question was emailed to your staff, forwarded to the health department, still not returned. And Governor, now that you've had the weekend to mull that over, will you be adding that to your executive order?
Yeah, the executive order gives a broad reach of powers in some respect, Greg. So there's a lot of tools in the toolbox that I could use. I've chosen, I think I've said this a number of times, I've chosen not to use those tools except in egregious cases. I mean, take, for example, the situation in Rutland with the gym. The Attorney General was involved. They ended up going to court. It ended up being resolved in some capacity, but that was the step we decided to take because someone decided to ignore the executive order. But so the powers are immense, but again, I've chosen to use this wisely and not to impose fines, not to impose any other sanctions, so to speak, at this point in time, because I think what we're doing is working. I think people are adhering. The vast majority of Vermonters are doing the right thing. And so we don't want to use a broad brush. We don't want to use our limited resources in public safety to go after people who aren't doing the right thing, because I'm not sure that it's going to gain us all that much. So again, I just understand that these powers are broad, and this is like a law in some respects when you impose something like this, an emergency executive order. But again, we think what we're doing is working.
So am I misunderstanding your statement from Friday that I was under the understanding that the executive order does not have any enforcement power for those who have tested positive and refused to quarantine?
No, I think.
Was I misunderstanding you when you said that?
No, we could impose many sanctions against those folks that don't choose to follow the executive order, because again, the powers are immense, but we've chosen not to go that route. But we could.
Okay. And I'll leave you with one more question here. I noticed on Interstate 89 there are new metal signs at incremental exits advising of the travel ban, you must quarantine, etc. Noting that these are fairly permanent metal signs, not electronic signs, what do you know as far as time frame that hasn't been shared with the general public? Because your executive order goes month to month, so
don't take the metal signs as some sort of sign, so to speak, for the future. It's just from a practical standpoint, the electronic signs are solar powered during the winter. The extent of the power is not as broad as in the summer. We don't get as much sunlight, and again, the cold weather cuts down on the amount of power that's necessary to light up the signs. So we just thought it was much more practical to make up these signs, and we could do it quickly and put them up. So we got them up and running within a week or two period. So we could very easily take them down in a week or two period. So this is it was just a practical, much more efficient and cost effective than the movable solar operated electronic signs.
All right, we're going to move to Wilson.
thank you, Governor, and happy holidays.
Yeah, thank you, Greg.
Wilson of the Associated Press.
Hi, good morning, everybody. Another question about the school. I'm not coming up with the right words to describe it, but while I certainly understand the goal of what you're trying to accomplish with that, doesn't that put the state and the schools, I suppose, in the position of getting kids to tattle on their parents? And that seems to have some, to me anyway, some pretty negative connotations that go with that. And I was wondering if that's something you thought through when you came up with this idea.
Yeah, again, I'm going to refer to Secretary French, but from my standpoint, this is, again, fair warning to those of you who are planning to have gatherings where you're having from outside your household at your homes for Thanksgiving. And if you don't want your kids to have to transition to remote learning in quarantine for a 7-day period, maybe you ought to make other plans. And that's the message right now. In terms of, we're asking people to tell the truth to protect others. I don't think it's tattling on anyone, and I'm not sure that it's all about the kids. The parents play a role in this as well. So, Secretary French, can you add to this?
Yes, Governor. Yeah, I think it's, it is challenging for school districts. What we did with our guidance is we situated this issue inside the daily health check, which is generally something that parents complete. So parents will basically be attesting to this along with their travel and symptoms of their students and so forth. So I think that's a good place to put it. And I know, Dr. Levine and I were on Vermont Vision the other day and listening to Superintendent Bonesfield from Montpelier. She used a strategy, I think, which is indicative of what a lot of leaders are doing now. She had surveyed her families well in advance, trying to get them to be forthcoming. So I think she remarked it's all about trust, and schools operate on trust with their parents and their students, and we're hopeful this guidance will give them some additional tools to help everyone do the right thing and keep schools safe.
Okay, great. Thank you very much.
Sean, the Chester Telegraph.
Thank you. Two very quick questions. Is there an update on rolling out the 14 expanded hours testing sites that were announced last week? And second, when the administration was putting together the Hazard Pay grant program, was any thought given to volunteer, like ambulance rescue, fire workers who risk COVID exposure but don't qualify as employees?
We'll answer the first one with maybe Secretary Smith. Are you on the line? Can you give an update on the testing?
I sure can, Governor. As you know, we rolled out 5 sites last week. We're rolling out additional sites this week. I'll get an update to the Chester newspaper on where those sites are. I don't have them sitting in front of me. And then we're on track to roll out the total 14 sites by the end of the month. So we are on track to do that right now.
In answer to your second question, I think I know the answer, but I'm going to ask Commissioner Pichek to answer that to make sure. He was the one that his agency headed that up. So, Commissioner Pichek.
Thank you, Governor, and I hope we give the same answer. But the answer to your question, Sean, is that, the program was designed, primarily by the legislature. We administered the program, but we didn't have, we didn't work on it in the legislature. It was something we volunteered to do, and we were happy to do it, and it was provided to us. My own mother volunteers at a soup kitchen. I know she was quite disappointed that she didn't get any of the hazard pay as well. So I think it was just one of these scenarios where not every scenario could be contemplated, and it had to be focused on those that were actually employees earning pay. But again, we didn't have a hand in that.
Okay, thank you very much.
Tom, BT Digger.
Thank you. I've been thinking about this Thanksgiving period. And we know from the ice rink outbreak and from Halloween parties that those were caused really by people who did not follow the guidelines. I was also thinking about President Reagan, who once said, "Trust but verify." The holiday travel period. Is there some movement, some possibility in between when you're asking people to do the right thing and then when you find that a case has developed because they didn't? Is there something in the middle that the state could do to encourage more strongly the people to do the right thing rather than, Governor, I appreciate you appealing to people's higher angels, but there are issues with that.
Yeah, Tom, I'm not naive. I understand that and I said that in my remarks, that I understand that some people are not going to do the right thing and are going to continue to gather. And we gave all kinds of warning and guidance before Halloween, and then we saw that there were a number of Halloween parties. But we need to, I don't want to get caught up in trying to look back, only to learn from what we experienced and to try and guide in the future. So the same will be here, because it'll be, obviously, even if we continue to trend downwards, which I'm hopeful that we're doing, because Halloween was 3 weeks in the past. Hopefully we'll be trending downward. It will be a week to 10 days or 2 weeks before we are able to see whether everyone complied, or the most people complied with our request not to gather. So we'll see the spike, if there is one, about week, 10 days, 2 weeks from now. So again, I'm not sure what we do to go backwards to try and right the wrong that already happened. We can only look forward and do the best we can and really reach out. And I'm counting on the media to send this message. I'm hopeful that people who are listening to this today will send the message. I hope that those that heard the message about schools and the questions that are going to be asked of you that may want to keep their kids in school for their own benefit will change plans. So that's our message for today. Really think about, is it worth it to have a big household gathering when you may have to keep your kids home for the next week or two, or you yourself might stay home, or the risk associated with that. Again, I think it's somewhere in between 25 and 50% could be in some areas of Vermont. If you had a household gathering in Washington County today or on Thursday, the risk of you becoming positive are somewhere between 25 and 50%, I believe. And that should be enough of a deterrent, I would think.
I guess we'll see.
Yeah, we'll see.
John, VPR.
Thank you. This is sort of a question about policing personal behavior. I've been hearing some pushback from local law enforcement about what they're being asked to do, especially with regard to checking on businesses for these health and safety assessments. And then secondly, they get fed these point-in-time complaints. Local agencies are funneled these through the state portal, and often they're, about 3 or 4 people getting together, or Joe's not wearing a mask. And this is coming at a time when local agencies are, in fact, trying to restrict their interactions with the public due to the pandemic. So I'm hoping maybe Commissioner Sherling could clarify what exactly is being asked of local law enforcement to do in terms of enforcing the governor's executive order and these COVID restrictions.
Commissioner Sherling, would you like to try and answer that?
Certainly. Thank you. Thanks for the question. So 2 paths here. One is relative to the health and safety assessments. Those have been put out to local agencies as options. If they want to participate, they're welcome to do so. If not, state assets are working on that. We've done just about 1,000 of those so far, and the numbers of notable non-compliance still haven't risen above 11 total. So again, large-scale compliance. We have a number of local agencies that are participating. Relative to what's coming through the portal and going out to law enforcement agencies, those are not a point-in-time instance. Those may be passed along for informational purposes, but the only things that are going out for potential, again, health and safety assessments and educational outreach are the ones that
are not those fleeting moments. They're really more business compliance kinds of things. And again, not large numbers, but a few things here and there that are worthy of educational follow-up.
And have there been, enforcement actions, prosecutions, fines, citations as a result of these?
No, again, as the governor described earlier, the primary mechanism at this point remains education, and that has worked incredibly well now for 9 months. There are a few folks that are a little more emboldened on non-compliance, but again, that number is a tiny handful compared to the thousands of businesses and individuals who are doing their best to ensure that they're keeping themselves, their friends and family, and their customers safe.
Great, thank you.
Kat, WCAS.
Hi, this question is for Dr. Levine. I had a viewer ask a question that I couldn't really find a good answer for, so I'll throw it to you. As we prepare for the first vaccine to be available, any sense of how long it takes between the time the person gets the COVID-19 vaccine and the time that their body develops the immunity to the virus? Is this a matter of like hours, days, or weeks?
Yeah, thanks, Kat. It's a matter of weeks, so it doesn't happen overnight. But I think the information we get from the trials themselves, where obviously these are participants in research, so they're probably having assessment of their antibody status done over periods of time. That would give us a much better picture. I think in the phase 1 or 2 trials, before these phase 3 trials, some of that information was available. I'm just not aware of it being any faster than a few weeks. But to qualify to get to the phase 3 trials, they did have to actually look at antibodies being formed in the subjects who got the vaccine.
And so then for the 2-dose shots, based on what we know right now about the vaccine, if someone only got one of the 2, as you indicated earlier, might happen despite best efforts to encourage them to get both, would they be partially protected with just one of the shots or not protected at all?
They would probably be partially protected. We see that with some of the vaccine experience we've had over, now decades and decades. Not optimal to only get one shot, not a guarantee you'll have any kind of protection that's meaningful, but possibly partial. But it's really, the ones that are being tested now that require 2 shots, it's because the earlier trials, I think, demonstrated that that's what's necessary to get a sustained antibody response.
Great, thank you.
Aaron, VT Digger.
Hi.
Go ahead,
I was
Aaron.
wondering if there has been, I was wondering if there have been any updates on state meetings with towns and local officials in terms of like what you've heard that local towns need from the state, and if the state is planning any kind of initiatives or programs or additional support for places that are experiencing outbreaks right now.
We did have some meetings with some local communities in Washington County. I know Secretary Smith, maybe Commissioner Sherling was involved in that. I might ask them if there's anything more to offer in terms of the question.
Yes, Governor, we met with local officials both in Washington County and Orange County and talked about how we can communicate a message to both of those counties through local, trusted local officials. So we really spent some time talking with them, asking them what they needed, provided them with information so that they could get it out to their communities, listened to them on some of the steps that they were taking, like closing some of their town halls or going remote with some of their town halls and others. As you know, we had Washington County, as Commissioner Pitek has talked about, is one of the most intense and hardest hit areas here in Vermont. So we spent a lot of time with them because of the situation in Washington County. we certainly would be amenable to meeting with other local officials if they ask. You know, we have regular meetings with the city of Burlington, for example. We have regular meetings with various entities on a regular basis, whether it's colleges, whether it's healthcare organizations, and as I said, with local officials in Washington and Orange County. So we would be amenable to having those same discussions in any county that felt that they needed some sort of assistance in what is going on in the transmittal of information to their citizens.
Aaron, we also,
I would just,
oh, go ahead, Mike.
sorry about that, Governor. I would just add, there is a weekly call held by the Emergency Operations Center with municipal officials to share information and take in requests for any kind of assistance that they may need or information that needs to flow.
And I was going to add as well, we have the League of Cities and Towns who have an open line of communication with us, as well as the Mayor's Coalition, as well as the 180 legislators that aren't shy about reaching out to us if there's a problem in their community. So we have all kinds of approaches that we're taking, as well as this forum today. So we hope we're staying in touch with communities across Vermont, but if anyone has a question, please let us know. I mean, if there's anything we can do, we want to help in any way we can. We can't solve all the problems, but again, we'll give it a try.
Governor, I also shout out to the Vermont League of Cities and Towns. They were very instrumental in helping both Commissioner Levine and myself meet with local officials and convey information to local officials in Orange and Washington County.
Okay, thank you. Also wanted to just say that I appreciate the new nursing home data that I asked for last week appearing in the following report. So thanks to the person who pulled that together.
Thank you, Aaron.
That's all.
Stewart, NBC5.
Thanks, Rebecca. Governor, a brand new U.S.-Canada task force has just started work on recommendations for how the northern border will eventually reopen. There are a couple of former governors, 2 former premiers or Canadian ministers on it. The key question seems to be how to make sure that there's public confidence and whether health screening should be incorporated into the usual, inspection process at the border. What would your team like to see? And have you had any communication with Quebec?
We are always speaking with Quebec. We try and keep an open line of communication with them, obviously being very important to us, sharing a border, our largest trading partner. Look forward to them coming back into Vermont and us going back into Quebec and Canada. But at this point in time, from my perspective, what we've been planning, we use the travel map and the modeling over the last number of months, and I think that that's been beneficial for us here as a region within the states. So I would like for us to look outward, and we've started to do that to keep track of their ridings and so forth in communities throughout Quebec, to be sure that we're using that same approach, because it works here in the States as a region, and I believe that it would work for us in Canada as well. So I think they have an interest, obviously, in keeping their province protected, and we have an interest in keeping our state protected as well. So I think there's a common interest with both of us. So I think we'll arrive at something, but I haven't been part of, nor do I know the composition of the group you're speaking to.
Okay, speaking of communication, have you had any regarding a potential Sanders cabinet appointment?
No.
Thank you.
All right, Joe, the Barton Chronicle.
Good morning. I Dr. Levine. Given the fact that UVM is taking part in the phase 3 trials for the AstraZeneca vaccine, would that eventually be approved? Does that mean that you and the Department of Health, working with the university, would have more insight into the qualities of the vaccine and how it might be used in the state than you would say for other vaccines?
That's a really good question, Joe. Thank you for that. I think the way these vaccine trials work, these are tens of thousands of participants who are enrolled into the studies, and the UVM component will be but a small part of that. The good news is the UVM component is going to probably reflect the Vermont demographic a little better, and that will mean it contributes more people at a higher age than some of the other sites might be contributing to the study, which will give us a little bit of insight. But from a statistical standpoint, the numbers of patients, participants in the study here may not give us as much insight as you'd want, because it just won't be a robust enough number. It'll be a significant number contributed to the study, just not a robust enough number to do a lot of independent statistical analysis on. It also probably won't mean we have any greater ability to access that vaccine just because we were a site, because this is, as you know, all being done on a federal basis, and we won't have any advantage in that.
Thank you. One other question, this I think for Commissioner Harrington. Looking at the state unemployment figures, it appears to me at least as if as many as nearly 10,000 people could drop off the unemployment rolls due to the ending of the CARES Act extensions of unemployment. That's about half the people who are currently receiving benefits. Is there any plan at all to provide additional assistance using state money?
Yeah, I'll answer part of that, and maybe Commissioner Harrington can add to it. But we've been, as we've spoken about in previous press conferences, I'm very concerned about this, and we've reached out to the Secretary of Labor as well as our congressional delegation. We're still continuing to do that outreach because, as you stated, this would have a detrimental effect on many who still need unemployment assistance. So to answer the second part of the question, we don't have the resources. We're talking, tens of millions of dollars every single week that we don't have. We can't dip into the trust fund, the unemployment trust fund, to use what we have for this purpose, and we don't have the resources to do this either. So at this point in time, we're hoping that the Secretary of Labor or Congress, there are many other states who fall in the same situation. They're facing the same dilemma that we are. So we are working with the other governors as well as our congressional delegation and others in the U.S. Congress to do something about this because, again, this will have a detrimental effect on individuals. Commissioner Harrington?
Governor, I think you hit on all the major points. I would simply add that, unfortunately, I think our biggest concern is that number is probably going to be a lot higher. It should all the programs that are expected to end in the coming weeks actually do, and that could also include a triggering off or an ending of our extended benefits program, as well as the Pandemic Emergency Unemployment Compensation Program, which is the CARES Act program, as well as the other CARES Act program known as PUA or Pandemic Unemployment Assistance. So when you add all those factors up and recognize that as people are moving through the traditional UI system, they're eventually coming up on those programs, should those programs end, it will have a much larger impact on this filing population as well as any new filers that come in the door. So as the governor said, we are actively monitoring this situation. To give some context, if we took the average weekly benefit amount and the number of people who are filing right now, we are looking at about $10 million each week in benefits that are being paid out. And if you were to subsidize, a state-funded extended benefits program, you're probably looking at anywhere from $150 to $200 million for a 13-week program. So again, certainly without outside of our reach as a state, and that's why it's so important that members at the federal level act as quickly as possible.
Yeah, and Joe, it's really important for Congress after they get back from their holiday break to take action, make the best deal they can, come together and do what's right for the people. And it may not be everything they want, but just as a stopgap measure, there are a number of initiatives they should be working on right now to help us, the states, and the people, and our constituents, the people, the citizens of our states, help them out. That's what they're there for. So I'm pleading with them to get back to work.
Governor, I would just add to this may be the right opportunity to say that while we haven't formally turned back on the work search requirement, that shouldn't dissuade anybody from actively looking for reemployment opportunities. UI has always been a finite amount of weeks. It's just a question of how many weeks, and really is meant as a bridge or a stopgap between employment opportunities. And so people who are on unemployment right now, if they are physically able to be looking for work and accepting work, they should be doing so.
And we can be a resource for that. We're the Labor Department, not the Unemployment Department. So we can help with that. So if anyone out there wants to work, can work, please reach out to us to go to our job link page and see what's there and what's available.
All right. Lisa, the Valley Reporter.
Hello, we've got some questions from local innkeepers about the new guidelines. Under the new no gathering or mixing of household guidelines, are innkeepers considered a household and thereby prevented from hosting any guests? And then secondarily, if they are allowed to accept guests, can they accept multiple individual reservations and still meet the no gathering of household guidance, since each individual reservation could represent a separate household in a separate room?
Secretary Curley?
Hi there, can you hear me?
Yes.
Yes.
Okay, great. Yes, so innkeepers are not considered, we don't have to worry about them being separate households. This is what they do, this is what they offer as their employment. People that come and stay in their inns, if they have their own rooms and their own bathroom, they can rent rooms to different households in those scenarios. Again, they shouldn't be pulling them together to dine close together, but set up just like a restaurant would, where separate households are seated at different tables, properly spaced according to our restaurant guidelines. I think I might have missed the third question in there.
Oh, there wasn't a third. It was,
sorry.
Each individual reservation represents a separate household, and I think you answered yes.
Yes.
Thank you. I have a question thank you very much, Secretary Curley. A quick question for Secretary Smith. Will there be increased testing available the week after Thanksgiving for returning college students? A reader notes that there's very little available on the Department of Health website for November 30th and afterwards.
Yeah, you'll see, thank you for the question. You'll see a fairly significant increase in the testing capabilities. I just want to make sure that people understand what we're talking about with testing. We have the new testing that's coming up online, and that is these on-demand testing, 7 days a week with multiple hours, including evening hours. Plus, we still have the pop-up testing that's going on when we see hotspots around the state that everybody's used to the pop-up. Registration will be coming online for those new testing, and I want to talk about that a little bit because I had an earlier question, and it was a great question. Last week, we opened up these new, what we call on-demand testing for Vermonters to come on demand, 7 days a week in Middlebury, Waterbury, Rutland, Brattleboro, and Burlington. This week, we've opened up additional sites in Berlin, Northfield, Stratton, Newport, St. Johnsbury, Fairleigh, and Bennington. And then next week, we'll be opening up sites in Springfield, Morrisville, White River Junction, and Franklin County, and we're finalizing the site in Franklin County. So there will be, there should be sufficient testing, as Dr. Levine talked about, and as Mike Pichek talked about. I mean, we tested over 41,000 people last 7 days. With a rolling average above 6,000. So there's a lot of testing going on above and beyond what is the normal college testing that will cut away, and then we'll have all these additional testing sites up and running.
Thank you very much.
And Lisa, you were referring to, just to make sure everyone's clear, referring to college students, Vermont kids, returning back home after for their break, correct?
Yes.
Okay. All right. Thanks.
All right, Guy Page.
Governor Scott or Commissioner Pichek, last year over Thanksgiving, the World Cup in Killington alone drew 36,500 attendees, many from out of state. That won't be happening this year. So is it really accurate to use 2019 Thanksgiving visitation numbers to project a spike in 2020 new cases, hospitalizations, deaths?
Yeah, thanks for the question, guys. So the mobility data about 2019 was simply for illustrative purposes to look at the amount of travel that occurred during the Thanksgiving weekend. We said it was over 100,000 people. We think maybe it was more like 125,000 people. So certainly that event could have contributed to a lot, but still quite a significant number separate from that. For the Thanksgiving analysis, we simply looked at recent national surveys about people's interest in continuing to have a holiday a dinner with guests of 10 or more, and then made some reasonable estimates about the percent of those visitors that would be out of state. So there are two different analyses, so the 2019 was not the basis for that Thanksgiving analysis.
Okay, thank you.
Tim, Vermont Business Magazine.
Hi, Governor. I noticed that several restaurants, including Halverson and Burlington, have decided to suspend operations definitely. Is the 75 million just not? Does the new 75 million just not enough? And what do you say to these small businesses, especially in the hospitality industry, that even with this extra money that you're providing, it's just not going to be enough?
Yeah, it definitely is not enough, and I think we've talked about that over the last month or so. But it is a stopgap measure, and it's a reality. That's what we had available to inject and to help some of these businesses survive. And I think that that's what we're seeing. Some are making the decision that it's just not worth staying open at this point in time. I'm taking from some of their comments that this is just a pause, that they are coming. They're going to be reopening at some point in time. And I'm hopeful that we'll see some action from Congress to provide more stimulus money so that we can put it in the pockets of those who are in desperate need. And we're going to see this, a bit of an uptick, I believe, over the next couple of months as we get over the hump. And so the hospitality sector alone has a need of $500 or $600 million, and we don't have the resources to provide them with that assistance at this point in time. But again, I'm hopeful that Congress will take action. I believe they will, but we'll see what the program looks like once they get back into session.
And it sounded like there's a little bit of a complaint because of what Lisa was mentioning about the inns, about the single household going to restaurants, that wasn't working for them. Any comment on that part of it?
We're just going back to, again, the data and the science, and we know what's driving the number of cases increasing, and it's being different households gathering together. So we wanted to be sure that we're doing all we can in providing, again, for some to utilize the restaurants within their household, within their family, and going to a restaurant. We're not seeing that there's the amount of spread of the virus in those situations. So we just think it's the best policy that we could put forward to get us through this. It's not ideal, obviously.
All right, great, thanks.
Lisa, the Waterbury Roundabout.
Good afternoon. I think my first question is for Secretary French.
Go ahead.
It's about the guidance that you've given to schools about the questionnaire that the students will be asked when they return after Thanksgiving. I was looking on the website. I don't see it posted yet. I'm wondering if that will be posted on the AOE site. And I'm wondering if you've asked school districts to communicate that to families before Thanksgiving break. I mean, most schools, today's the last day that school is in session before Thanksgiving holiday. And as a parent of a middle schooler, I don't participate at all in the survey that my daughter receives every day when she goes to school. The middle school kids answer those questions independently after they've been dropped off, etc. I'm just wondering, how parents will get the heads up that this is going to be part of the screening when their kids return to school next week.
Yeah, thanks for the question. Yes, the guidance should be up. If not, we can send a copy out to you. Did go out late yesterday afternoon, and I know to your question, districts are in the process of communicating that to the families right now. And you're correct. In some districts, particularly with older students, we see the students themselves completing the health check, but it's more common that parents do that, particularly with the younger students. But it is, I think, fair question about the urgency relative to the executive order, which came out on Friday. When my communications with the school districts, I'm also saying that this is the likely disposition will be in through this next several weeks, and possibly including the winter holiday at the end of December. So I think everyone needs to settle in a bit and assume this will be sort of the standard going forward in the next several weeks.
Okay, good. Thank you. I have a second question for Dr. Levine, if that's okay.
Sure.
On Friday, Vermont Digger had a small story about cases at UVM Medical Center where staff had tested positive. They were looking at a recent group, and it noted that to date since March, there have been 79 positive cases among staff at UVM Medical Center. I know that number, as of yesterday, had gone from 79 to 88 cases. Full disclosure, I live with a healthcare worker. The fact right now is that the hospital is not testing or having their doctors, the attending physicians, the residents, the nurses, the clinical staff, those people who are on the front lines are not getting tested regularly unless they experience symptoms. The only people getting tested with any regularity are the medical students because they're students. And so I'm wondering, to me that seems like a big hole in the system, although it would need to have to be a regular thing in order for that to be meaningful. Do you see it as being a priority where healthcare staff, especially given the surge that we're seeing in cases right now, start having some testing worked into their routine?
Yeah, so first of all, there have been cases in healthcare workers across the state. I think that's testimony to the fact that they are in the front lines and they truly get exposed in other ways. But I do think that if you look at them as a percentage of total healthcare workers, it's a very small number still, which is also testimony to how safe they try to keep themselves with the use of personal protective equipment. The reality is that every hospital in the state had to submit a plan for testing of their staff, and that is surveillance testing, just like we're doing with the teachers. And this was part of the reopening of the hospital sector and the healthcare sector during the whole time we were reopening one sector at a time. So there is a plan that both that medical center and all the other hospitals in the state have presented us with and are supposed to be adhering to. I can obviously get a little look into making sure that that's been adhered to this point in time because it is important. Also want to make sure it wasn't impacted in any adverse way by their cybersecurity issues. But there are plans in place for all of the healthcare sector to be tested on a regular basis.
Wow. Well, I know many healthcare workers who have yet to have a test.
Yeah, that concerns me, so I will look into that.
Okay. Thank you. Thank you. And that's all for today. Happy Thanksgiving to everyone.
Thank you, Lisa.
Next, we'll go to Greg with the Bennington Banner.
Greetings from Southern Vermont. This question might be for Secretary French. I was wondering if I could get some clarification on the remote learning. Essentially, is that the same as a quarantine? Are we asking these students to and their families to quarantine for 14 days or 7 with a negative PCR test? Or is this really just only about remote learning? And that gets into the question of, 14 days being 2 full weeks, but nearly 3 school weeks. So I just wonder if you can clarify the language a little bit on that.
Yeah, hi, Greg. It's more about quarantining individual behaviors, group behaviors that those households, multi-households got together. The remote learning is still available. I think you'll see schools make the decisions about in-person or remote more based on their staffing considerations and so forth. But the quarantine requirement is there for the multi-household social gathering.
Okay. While I had you on the line, Secretary, was there any thought to simply going full remote for 2 weeks after Thanksgiving? I wonder if you just kind of discuss your thinking about that and whether you weighed sort of the disruption that would cause against sort of having a gold standard of having everyone at home for 2 weeks.
Yeah, I mean, from
and obviously that's not academically what you want. That's not what you're trying to do. You're trying to have students in school. I understand that, but I just wonder if you can take me through that.
Yeah, sure. I think from our perspective, our team with the health department, we looked at certainly, the rise in case counts and, considered that as an issue. But, our data continues to support us being able to operate schools in person safely. I think, where this question came up about a holiday around the concept here of sort of continuous operation points more to staffing issues, not necessarily a reflection of the conditions of the virus. So from the state decision-making level, I think we make those types of decisions if the conditions in the virus warranted it, but they don't. So we'll see individual districts address staffing issues as they have all along. And we think that's the best sort of, division and sort of decision-making, letting the locals be responsive to their specific staffing considerations and the state keeping an eye on the health conditions.
Okay, and you did say that essentially that this might be something that stays in place through the winter holidays?
Yeah, I think certainly for the next couple of weeks, we're watching very closely, how the case counts go, but with the prospect of other holidays coming soon, I think it's, certainly weighing on our minds significantly about how to manage that.
Okay, thank you very much. That's it.
Ed, Newport Daily Express. Ed?
Yeah, hello, this is Ed. Yep, this is Ed. Good afternoon, everybody. My first question now pertains to a request that came from the Glover Select Board last night to the elementary school board. They've historically held town meetings for generations in the town hall. It's well attended. With the pandemic, still hot. They're not sure what's going to happen at March or town meeting day, but they're pretty sure there's no way they'll be able to use the town hall. They'd like to use the elementary school gym as an alternative, but according to the law, because they've never used the gym before, they're not allowed to move the town meeting up there, and they do not want to do remote or Australian ballot. The governor is there, perhaps a way, because of the timing of this, they need to have a decision on a location in January. Is there something you can do through an executive order that will allow municipalities to be able to move over to a school gym to be able to have enough space to accommodate everybody?
Yeah, thanks for the question, Ed. I'm sure we'll be having a lot of discussions about town meeting in January. I'm very concerned. Obviously, I don't believe that the problem, the crisis, will be solved by March. That's why I promoted the fact that we may want to go to mail-in type ballots, just as we did with the general election. I know that there's been some talk within the legislature about the possibility of moving town meeting day to a later date. I tried that 3 or 4 years ago, as you might remember. It didn't go over so well, so we'll see how much luck actually it didn't go over well with the legislature, so we'll see how effective that is. But we'll do whatever we can to assist. I'm not sure what prevents, and again, without getting into the law and what prevents them from having that gathering in another location, but we'd be happy to consider that. I know the legislature will be taking a look at that as well. So please make sure that those in your community that have issues such as this will reach out to their legislative delegation so that they know what the challenges are, so that we can address them when the legislature comes back into session.
Yeah, the genesis of this came from a law that was passed a few years back. I believe it involved school shooting, in which they wanted to limit the public access to the schools and grandfathered in, the municipalities that held their town meetings at the school. Another question for you, I'll move to a separate subject, which is we've heard a lot about Thanksgiving and deer camp. I haven't heard much about one of the biggest events that's going to take place this month, and that's Black Friday. Do you have anything that you'd like to share there with the realtors to make sure that they're not letting mobs and mobs of people in and ignoring, the social distancing, even if they wear masks?
Yeah, very good point, Ed, and something we are concerned about, and we hope that retailers will adhere to the guidance, make sure that we don't have a problem after the holiday, after Thanksgiving. So you bring up a good point, and again, for those who are listening, if you don't have to, it comes down to want and need. If you don't have to shop, don't. If you don't have to go out and get into those situations, don't. We're trying to prevent mass gatherings of this nature for long periods of time. So really reflect on that. And again, to the retailers, please adhere to the guidance that we provided and keep your customers safe. I might ask Secretary Curley if there's anything she'd like to offer or add to that.
No, Governor, I think you nailed it. Perfect.
Very good. Thank you, and happy Thanksgiving.
Thanks. You too, Ed.
All right. It is 12:50, and there are 5 folks left in the queue. We'll move to Avery, WCAX.
Governor, my question goes back to compliance and enforcement of the guidelines. We're hearing from officials in Randolph that there's a lot of non-compliance in that community. We even were forwarded a letter from the Orange Southwest School District that said that 1/3 of the families that the district spoke with, the families who spoke with contract tracers, just didn't care about following the rules. Have you heard those concerns from them, and what do you say to that?
Yeah, I have not personally heard, and I'm not saying that they haven't reached out to some of the administration, but, we'll look into it. I might ask Commissioner Sherling if he's heard about that directly in Randolph.
Thanks, Governor. No, not specifically. As I indicated earlier, we're up around 1,000 health and safety assessments that have been done. So while the spreadsheet was relatively easy to sort a couple of weeks ago, it's not as easy to sort now with that many lines of data, but we'll take a look.
Thank you.
Steve, NEKTV?
Hi, can you hear me?
Ken?
Hi, I'm not sure what's going on in Clover, but Troy has held their annual meetings, the town meetings, in the school gymnasium, for years now. But I was unsure about any law that prohibited that.
Yeah, I don't think it's specific to those situations, because in Berlin, where I live, they have it in the school as well. So it's something unique to the law. So we'll work our way through that.
Great, interesting. Secretary French, I had another question about the mechanism of the reporting from children about gatherings. The compliance rate, when you send letters home or questionnaires home, what the return rate is on those, and do you recontact the parents who don't return the things, and wouldn't that have a lag time which would diminish the whole point of this?
Yeah, thanks. No, firstly, the questionnaire we're talking about is what we call the daily health check. It's not something that's administered at the state level. It's administered on a daily basis at school district level, at school level, for all students and staff. And this really pertains to in-person instruction. So on a daily basis, in order to enter school facilities, the daily health check has to be completed. It includes a number of questions pertaining to symptoms, a temperature check, fairly recently an update to the travel, and now it may include the questions about multi-household gatherings. So it's something that happens in real time at the school level in order to enter facilities for in-person instruction.
Sure, I see. So the kids are questioned individually when they daily.
Yes, and as I was saying, in most cases, parents are completing those questionnaires at home in the morning. The temperature check component still happens at the school by school staff.
I see. Thank you. One for Dr. Levine, if I may.
Is that your German Shepherd in the background, Steve?
No, actually, it's a Jack Russell puppy. They bark for affirmation. I really had my head again.
Go ahead.
Thanks. Dr. Levine, we've seen the SARS had a confirmed fatality rate of 9%, MERS was 10%. Even TB to this day has a CFR of like 15%. And I've watched the CFR, the mortality rate, drop precipitously since the outbreak of this virus. Could you tell me about now, at this point in time, what the confirmed fatality rate is for this virus?
Sure. The dog sounds extra interested in this piece of information. I will have to hedge a little because there is not like a uniform number. This is data from the country, the world, changing all the time. I'm hearing closer to the 2% range, possibly in the 2s, so between 2 and 3%, which is still significantly higher than, let's say, influenza. But at the same time, no matter what the number is, I regard it as very significant, obviously.
And doesn't it vary very significantly by age groups?
Oh, absolutely, yes. The 2% to 3% is an aggregate number, but if you start parsing the data by decades of life, etc., it will obviously be much higher in the very oldest. And our Vermont data bears that out as well.
Okay, great. I guess that's it for me. I'll use up my time. Thanks. Happy Thanksgiving for everybody.
You too, Steve.
Thank you.
Keith, the Rutland Herald.
Here.
Go ahead, Keith.
Hi, I was wondering if we had any greater clarity on why it took so much arm twisting to get several large retailers to sign up for the state's hazard pay program. And I'm also curious if their seeming reluctance or whatever it was will be accounted for in the future when we design these programs or update them.
Hopefully we don't have to have these programs in the future, Keith, but I'll let Commissioner Pichak answer.
Hi, Keith. Thanks for the question. So, I think in a lot of the cases, it was about informing the large retailer about the program. They just weren't aware of it. Obviously their employees on the ground were aware of it, but their corporate offices were not in Vermont. Maybe they were on the other side of the country, and it took some time to get the information to the right decision maker. And then once they were aware of the program, explaining to them how it worked, how it didn't impact their business financially, how it really was designed to be solely a benefit for their employees, did allow them, in almost every instance, to make the decision to apply. Again, a lot of these companies are large bureaucratic companies. It took them a little longer to get there, but at the end of the day, almost all of them did.
Thank you.
All right, Jolie, Local 22.
Is if you guys foresee any companies throughout Vermont or any sites that will provide free testing, and if you're concerned at all that people would avoid getting tested due to a bill coming their way.
I'll let Secretary Smith answer that, but I think there's no charge for the testing. Secretary Smith?
That's correct, Governor. Since the beginning, with our pop-ups that have been throughout the state and our new sites for on-demand testing, which are fairly substantial, there has been no charge to the individual for showing up and getting tested.
Okay, thank you.
Colin, 7 days.
Yeah, hi. I think this question might be for Secretary Smith, but I'm curious whether there is any concern that these surging cases will render our contact tracing efforts ineffective at any point. How close are we to that point? At what point would that happen? Yeah.
Yeah, we've had a number of conversations about this within our team, and we anticipated, when we first started seeing the rise in cases, we, previous to that, had a reserve of EPI contact tracers available to us, and we've ramped that up significantly since then, have even reached out to a number of organizations like the National Guard has provided members as well to help us out. So we're in pretty good shape, and we're getting in better shape as time goes on. But we were, admittedly stretched to our capacity when we had that big surge in the beginning. But we're catching up now, and we're adding contact tracers every single day. Secretary Smith?
Sure, Governor, you hit the nail on the head here. We expect that we'll be up to 104 FTEs by December 7th. Just to give you some indication of what FTEs we were before November, it was 23, and as we ramped up, we expect to move right up to 104 FTEs by December 7th. That's next week, by the way. So It's pretty, well, it's a week and a day away, so it's pretty substantial.
And this is Dr. Levine, Colin, just to add my perspective, nothing to add to the numbers part, but the whole reason for your question, just for listeners, is can we continue to practice containment at the current levels of virus? And our answer from our epi section and public health is definitely yes. And I need to put that in perspective for people, because yesterday the CDC came out with new guidelines regarding how states should prioritize their containment strategy and their contact tracing. And the reality is the country is overrun with virus right now. And so there are abundant states, including many in New England, to be honest, that have already started a prioritization scheme to address the contact tracing needs that they have and deficits that they have. And as the governor said, when that surge hit us, it was literally within days, and it was very hard to cope with that level of surge. Fortunately, things have, I'll say, moderated. You know, it's not over by any means. And we have all of the FTEs that the secretary just mentioned. But the CDC is really telling states how to, in a organized way that makes sense for their state, not do as much contact tracing as they're doing because they're unable to keep up with it. We hope to not have that situation arise here in Vermont.
Thanks, all three of you, for answering that. And then just lastly, I mean, the question for me comes up when we see New Hampshire, where I think they decided to scale back their efforts and they had about 200 cases a day, which is twice what we were at for a minute there, and we are half the size. So I was just curious as to whether we were nearing what they were at. But those numbers that we saw about what could possibly happen if people decide to gather, as they usually do for Thanksgiving, the 3,000 or so cases. I mean, if that were to happen, would we risk overwhelming our contact tracers, or is there any concern that we could get to that point if people don't follow the guidance?
Yeah, I think Commissioner Petrak will agree that that was as worst the case scenario as you could draw. And much like much of the projections we've had all year long, we have sort of where we expect things to go, and then we have best case and worst case scenarios. So clearly, if it got to the worst case scenario, we would be in far more trouble than just our contact tracing workforce in terms of our healthcare system capacity, et cetera. So that would be a very dire place. So if we got to the level that New Hampshire was at, we could still accommodate that very well. And this gives me a great opportunity to just recognize our contact tracing workforce and our members of our EPI section. This has been an incredible burden on them, working long hours, coming in for extra hours, et cetera, to try to keep up with this demand, on top of managing the pandemic for this many months. So just want to recognize them as well.
Thanks.
All right.
Governor, just one quick question. The incoming administration is talking about perhaps a national policy towards the COVID response. Is that going to be sort of the broad brush that you're worried about, you know?
Yeah, I unless they use Vermont as an example for the rest of the country, I can't imagine that we would have to do anything different than we're doing today. Obviously, everything that we've put into place has had a positive effect. So I don't believe that they are going to implement anything from a broad perspective. They may have triggers and so forth and advice as to what should happen. But by that time, I would offer, I think the vaccine rollout will be well underway at that point in time when the new administration takes office. With that, I think that's everyone. I want to wish everyone a very warm and happy Thanksgiving. And I do hope everyone reflects on those who aren't as blessed as some of us are, and try and take care of them. As Dr. Levine had said, reach out, help others who are disadvantaged, make donations, do whatever you can to help one another, and we'll get through this one way or another. And I know this is going to be abnormal and different, but you know, we're Vermont strong, and we'll get through this. So thank you very much, and we'll see you on Friday.